I just kind of wanted to ask, like, I can see kind of now that it's for the M&A, the Minnesota Nurses Association, but why are you guys out here?
We're out here fighting for issues that we feel are greatly impacting safe staffing within the organization.
So what's happening right now that's caused you to come out and kind of spread the word?
Even for the past 2 years, we've had the hospital not staffing to core, which means for average daily census.
I'm sorry, the honking probably drowned that out. Could you repeat it?
I said for even the past 2 years, the hospital is not staffed to average daily census of patients, meaning we have X number of patients, we need that many nurses.
Okay, so you don't have enough nurses to meet the demand of the patients incoming to get the proper care.
Correct, and so the solution to that is to have people beg them every day to come in and cover the holes that are needed to care for the patients. It may be even to mandate them or make them stay 12 or even 16-hour shifts to care for your patients.
Okay, and these are all things that you've brought up with local hospital officials and everything.
Correct.
Okay, and how have they responded so far?
We have pretty much had a response that they're not going to increase any nursing FTEs, and this just isn't about just nursing, it's about nursing assistants and the supportive staff also.
Supportive staff, okay.
Correct.
And so right now you guys just feel it's not sufficient, the amount of staff that's currently there. Have they brought any reasons forth to...
we've been told we've actually overstaffed. We're over what we need for the FTEs, and the driver there or, saying we're over is about money.
Okay, so it's about budgetary reasons, that's what they're telling you?
Correct.
Okay. And I guess what's your...
Obamacare and the ACA and everything, that's going to be the excuse for everything moving forward. But what I want you to know is Mayo as an enterprise made $350 million last year. And as we move forward, they're going to receive millions of dollars to build a regional center over in Rochester.
In Rochester?
Right.
Okay. All right. How long have you guys been out here today?
We've been out here since 7 o'clock this morning.
Okay. Is this the first day, or have there been other...
This is the first day, and we plan on being out here all day till 7 o'clock tonight.
All day till 7 o'clock tonight? All right.
Another safety issue I want you to be aware of is their plan to cut RNs in half and replace them with dialysis technicians in the dialysis unit here in Mankato and also in New Ulm. Those dialysis technicians may have no previous medical knowledge, and the training course they plan for them is 10 to 14 weeks.
10 to 14 weeks? Wow. Okay.
So in the past, all these studies that have said RNs save lives, and the organization have gone to all these RNs because they save lives, and all of a sudden we don't need those RNs to save lives. We have less because of money.
Okay. And do you think there's going to be expected cuts coming in the future even? I know a lot of people are talking about that in all types of industries, and I can imagine the hospitals being the same. Are they talking about more cuts, or are they...
I don't know that they've talked about more cuts. Do I expect that could happen? Absolutely I do. I guess what I want the community to know is that they need to be involved so they understand. As nurses, we say we want you involved because you need to know and tell the community what's safe. You're at the bedside, they don't know. So we need to inform the public. I'd like the public to be involved at a community level, at a state level, at a legislative level to help drive maybe what the future of healthcare looks like, not corporate hospitals, and have the driver be about money.
Okay. And how much of an impact do you think Mayo itself as a company has on this community in terms of healthcare?
I think they have a huge impact, not only within this community, in the Southwest region, and Rochester, throughout the state. They have, beyond the state, they have clinics and hospitals.
Are there many other options for people other than Mayo in this community?
There are. They're getting to be fewer and fewer as Mayo continues to suck up all these outlying satellite clinics, and makes it tough.
We are the nurses. Mighty, mighty nurses. Fighting for patients. Fighting for community. Fighting for staffing. all the nurses.
We are the nurses.
Mighty